Welcome to the Optiflow guide created by the Heat team. We will take you through all the equipment required to commence Optiflow on your patient. Firstly, select the correct prong size for your patient. Please be mindful that only red and yellow prongs go with Optiflow. The labels can assist you when choosing the correct prong size for your patient. 50 to 75% of the nostril should be occluded, inclusive of any feeding tubes. The minimum and maximum flows are also indicated on the packaging. An Optiflow tubing kit contains a circuit and a humidification chamber. You will also need a sterile water, and please check the expiry date, in addition to green tubing. Ensure that the device is plugged into its essential supply socket. You can check the device is pressurised by turning the dial on the flow meter. Select the sterile water and humidification chamber. Slide the humidification chamber onto the humidifier as shown. When sliding the humidification chamber in, it should click as follows. Spike the bag of sterile water, and this will automatically drain into your humidification chamber. Now take the pressure manifold, which can be found within the circuit. Ensure that this bung is tightly pressed in, as this could cause potential leaks. Attach the pressure manifold to the humidification chamber. Now take the green tubing and apply one end of the green tubing on the pressure manifold and attach the other end of the green tubing onto the flow meter. Now take the blue ventilator circuit and push onto humidification chamber. Please be aware that only one end will fit onto the humidification chamber. There are two temperature leads that need to be pushed into this end of the circuit. One is a 3-pin and one is a 2-pin. Please ensure that this is pushed in tightly and it should click into place. A third single pin temperature probe is pushed into the patient end of the circuit. Now take your chosen interface and apply onto the end of the patient circuit. Use the flow meter to set the desired flow and the air oxygen blender to set the desired oxygen. Use the power button to turn the humidifier on. The temperature will automatically go to invasive mode, and this is the correct mode for Optiflow. If the temperature changes to non-invasive, to go back to invasive mode, hold down this button. To fit the interface to your patient, carefully remove the backing to the inner corners and apply to the patient's face. Remove the rest of the backing once on the patient's face to secure. Ensure the septum is not pressed on by any of the prongs and the nostrils are only 50 to 75% occluded. Ensure nasal prongs are removed for nebulizers by peeling back the velcro and leaving the wiggle pads in situ. When stopping therapy, take both the oxygen and the air out of the ports in the wall. Remove the green tubing, the blue circuit, the humidification chamber and the patient interface and dispose of appropriately. Please ensure that all temperature probes are taken out. These are cleaned and are not discarded. Push down the blue bar and this will allow your humidification chamber to slide out. The water can also be disposed of. Again, please ensure that these temperature wires are not thrown away and are kept with the humidifier. Thank you for watching the Optiflow setup. For any queries, please contact the heat team.
Please be aware that new prongs have launched. The flows remain the same, but please familiarize yourself with the information on this slide. Thank you.